Dr. Kelly Blodgett is redefining the modern dental experience. Over the past 20 years, he has created a practice recognized as an international hotspot for integrative biological dentistry and dental tourism. He attracts people who seek a holistic and biological approach to their oral health and whole body health. Through his weekly Toxic Tuesday and Wellness Wednesday social media posts, Dr. Kelly shares truths not commonly discussed in traditional dental settings. His post series illustrates his patients' incredible journeys back to health, along with providing best practices for predictable oral and systemic health. In today's episode, we'll talk about the biological way of approaching root canals, oral hygiene, regaining health, demystifying health issues caused by teeth, and making the connection between root canals and breast cancer and our lymphatic drainage pathways, along with understanding best practices for biohacking oral health. It's a pleasure to welcome Dr. Kelly to the show. Dr. Blodgett, I've wanted you on the show for so long. I have been waiting, and I'm so excited that you're here. Thank you for spending an hour of your time with me to talk all about dental health, root canals, and what it means to be a holistic functional dentist.
Awesome. Thank you, Kelly. I'm excited. I'm excited about you're being pumped to talk about oral health,
Yeah.
Go figure.
It's interesting because being in nutrition for as long as I've been in nutrition and working hand in hand with functional MDs and their patients, my clients, and being on this path myself for so long, it's amazing that dentistry was so segregated from, it wasn't part of the conversation around the microbiome. It wasn't part of the conversation around health. I mean, it was go to your dentist, get your cleaning, call it a day. So I want you to bring to light the connection between whole body health and oral health.
Sure. Where shall we start, Kelly? This is, well, I think that, it's kind of an interesting thing that from the perspective of gut health and the awareness that's been created with, the functionality of the gut system, that the mouth being the opening, the starting point of the GI tract, it's just kind of ignored. There's a great book called Gut by Dr. Julia Enders that I read it a few years ago, and what I loved about it was that she spent so much time talking about the mouth, because it's like, well, before you get down to the duodenum or the large intestine or whatever, like let's talk about the entry point. And of course, historically, so many things have been done in people's mouths as a means of trying to stop decay, in particular, which of course has been more and more on the rise over the past 2 centuries with our processed diets. But so many of the things we put in people's mouths, like mercury fillings, for instance, or slathering fluoride over everything, which, on one hand, it does make teeth more acid resistant, but your mucosa also absorbs it, inside your body. So there's a lot of toxic stuff that's been being put in people's mouths, which will impact our overall wellness. But to your point, like, it's almost like dentistry as a profession or a means of healthcare is totally divorced from the rest of medicine. Mm-hmm. We have our own schools. There's your own dental insurance, which tells everybody, well, okay, you all fit out into this box somehow, right? Apparently, every human being needs a cleaning every 6 months, unless we tell you have some risk for gum disease. Then we'll see you every 3 to 4 months. And somehow we all fit into one of those 2 boxes. And it's like, that's just silly. It doesn't make any sense at all. Not to say that those timeframes aren't appropriate for some people. Surely that is. But what about the person who is burning down? And maybe we need to see them once a month, or somebody that hasn't seen a dentist in 5 years and there's not a bit of tartar on their teeth and their gums look healthy. It's like there's such a gamut, but the system isn't built, it's built to put people in boxes, and there's kind of a one size fits all solution.
It's interesting because so many dentists continue on the traditional route. They go to dentistry school, they do the mercury fillings, they do the fluoride treatments. I remember posting about fluoride and my fluoride-free toothpaste. I was using hydroxyapatite with my kids and myself, being pregnant so often. And the blowback I got in comments was just a little like,
Yep.
I didn't realize it was such a charged topic, but
Oh man.
can you talk about, for you personally, I mean,
Sure.
how did you find your way into holistic dentistry, or do they call it biologic
Yeah.
dentistry, or
Well, here, what I mean, it's kind of funny because if you think about as a healthcare provider, every dentist who's practicing took the Hippocratic Oath to first do no harm. So if we come to understand, which you easily can if you go to PubMed and type in like, fluoride and IQ, or dental mercury amalgam fillings and, neurodegenerative disease, things like that, right? You'll find all these studies that are very clearly showing that by absorbing those chemicals into your body, it will have negative neurological impact.
Mhm.
So, why so much pushback? Like, I really don't know. I mean, if people want to use it, hey, by all means, I think you have a right to choose that, provided you have all the information. Which that's the challenge I find in well, this is probably true in healthcare in general, but when your provider, who most people are looking at as an expert, tells you you need fill in the blank, Kelly, you need a root canal. You're like, okay, well, like, how am I to know any different, right? So you just do what they tell you to do because you need it. And there's no truth to that. Certainly, like if a tooth is dying or it's in pain, that's one option, but it's also an option to remove the tooth, because what nobody, or I should say, very few people are being told is that when you have a root canal done, have a dead organ connected to living bone that constantly allows microbes to crawl through the root system into your living bone. So if people don't want an open source for microbial invasion, they would not choose a root canal, but that's not discussed.
No, it's not. And since you brought it up, we should just go there. For everyone listening, I was 25 years old when I was recommended to get a root canal, and I had one cavity, and this was all of a sudden I needed a root canal. And I was like, well, geez, of course, like I'll go get the root canal done.
Right.
And I did. And I'll be 40 in July. So that was quite a while ago. And last year I started having nightmares that I was using pliers to rip that tooth out, that I was like digging with like my silverware to try and pull it out, that it was falling out, like repetitive. And I went to my dentist, and like I always do, I go every 4 months. My family has a history of periodontal disease, and I do that extra work and see my dentist more often. And I said, I need an x-ray to see like what's going on here. Like I'm not in pain, but it's like my intuition and something is like, it is not right. And they did a regular, I think, a 2D x-ray, and nothing showed. And I said, I know it looks fine, but like, can I get a second opinion? And ultimately I went to an endodontist, and I got, I think, a 3D scan because it gave us way more. I kind of think about it as a mammography versus tomography, 2D versus 3D. That was in my past life when I worked in breast cancer. There was like this massive increase in breast cancer diagnosis. And it wasn't that there was more breast cancer. It's that we had better imaging and we could see it. And I had full bone loss between the two roots. And so he explained that the options were to do this wave technology, which you can maybe talk to, is like sound waves, clean it out using like special instruments and tools, and then refill it and cap it, and I could get a new crown on that tooth. Or I could do this longer process where he, does the wave technology, cleans it out, puts a product inside that would keep microbes from growing. And then we'd wait and see if the bone grows back. And then when it's fully healed, then we would fill it and cap it. And I was like, well, no offense, but obviously that's the way I'm going to go. I'm going to come, every 6 weeks or every couple of months. And it has been a year and my bone is back. It's grown back and it looks good on 3D, but it doesn't look perfect. And it still feels weird to me and it kind of bothers me. And the oral hygienist that I have at my regular dentist is like, from my experience, your gums look great, your teeth all look great. This tooth and the gum around it is not happy, and it hasn't been happy for the last year, and it's still not happy. And I know from when I floss that maybe people are like, I don't want to know about your gums bleeding, but it bleeds more there. And I'm like, something like it just doesn't feel right. Like something feels wrong. And she said, there may be a crack in this root that they can't see on imaging. And so then, then I find myself down an Instagram rabbit hole talking to some of my friends like Peter Crone, who's like, you need to talk to Kelly. He needs to just talk you through what he's doing and how it's different and why he's doing what he's doing. So I need all the expertise. And for people listening who have root canals, have had this process, like I think about the people who just trusted the endodontist to clean it out once and refill it and not to know that their bone has grown back, like that is just I want to think about it like an open gaping sore inside your mouth that is directly heading into your blood supply and all of that.
Yeah. Well, and it's perhaps the area of dentistry about which I'm most passionate, primarily because of the vernacular used around root canals, right? It's that power trip of you need this. People they get no other option, so they go and have it done. And then oftentimes experience exactly what you're sharing, which is it doesn't feel right. Like, I don't know necessarily how to put into words what I'm experiencing, but for crying out loud, you're having nightmares about pulling out your own stinking tooth. That's your body talking to you very loudly, but you get poo-pooed, right? Like, oh, well, that's just dreams. It looks fine. So in my mind, well, let me back up and I'll share a little bit of anatomical truth that any dentist would acknowledge. Okay. So when you and I are talking and smiling at each other, the part of the teeth that we see is enamel. And we've all heard about enamel. You hear it about on toothpaste commercials, whatever. And it is crazy hard. And generally speaking, it's impervious to anything, right? Yeah. Like sometimes acid can break it down and then bacteria can make their way in. But healthy enamel is just rock solid. The dentin, which is actually the majority of your tooth structure, is primarily made of mineralized collagen, and it has millions of little tubules, and each one of those little tubules is about 10 to 20 times wider than the diameter of the microbes that live under your gums. So imagine when it's a healthy tooth and it's filled with living blood supply, nerves, lymphatic drainage, all this stuff that's inside the tooth. Those little tubules are filled by the soft tissue of the nerves that stick in there. It's like, if you touch a root, right, and it's sensitive, that's the nerve that lives inside those tubules that's speaking to you. As soon as you do a root canal, all that stuff goes away. Now it's an open system. Even if the endodontist or dentist goes inside the tooth, cleans out the little canal system, seals it up on the inside. The best analogy I can think of is, imagine if you took a boat out on a lake and you lined the inside of this boat with some sort of sealer, but the entire hull is made of sponge. So as soon as you put it in the lake, it starts absorbing all the water, and what do you know? Like, it starts to sink. And that's what happens with teeth, is that microbes, the second you no longer have an immune system connection to that tooth, microbes start filling up the dentin. these little tubules are not linear. They don't go straight into the tooth. They make all sorts of funky little twists and curves. And next thing you know, you've got loss of mineral from your bone that you're having dreams about, right? So it's a sinking ship, I guess, is probably the simple way of putting it. What I find so frustrating is that when people go to their dentist and say, like whether it's a week later or 10 years later, and they say, I don't know what's going on, but it doesn't feel right. Mm-hmm. The degree to which people are basically just disregarded, like their input is discounted. It's really sad, because, my background before going into dentistry was in psychology. And, I was admitted to a master's program and was going to head in that direction, as was my wife, interestingly enough. And I learned a lot about listening to human beings and acknowledging their truth. And I mean, I just had it happen this week where somebody was describing something to me. I couldn't make, from an objective perspective, I couldn't quite validate what they were sharing with me, but I trusted their intuition and their experience. Mm-hmm. And we moved forward because of the weight that we put on their experience. And lo and behold, it led us to a resolution of their symptoms. It was like, wow, there's so much power in what people share with us. But when we're not listening or we're not willing to listen, we really lose the ability to help people in a meaningful way.
Yeah, it is. Luckily, like, I'm with a dentist who I trust very much and is so kind and open and loving and like, whatever I'm showing you this image, but if you feel differently, like, absolutely. And is really, really good at listening. But I look back probably, I don't know, my whole history. Like I said, I'm going to be 40. I've only been with this dentist for 2.5, 3 years. So when I look back, it's like, that wasn't my experience. And I think for a lot of people, self-advocacy is hard.
Yeah.
And
absolutely.
you really want to trust the expert that you've put your health in their hands, and you want to know that you're being taken care of and that you have informed consent, and you know what all the options are and what, the downside could be. Like, I definitely wasn't asking the right questions, nor did I have the information to understand that a root canal might fail. It might fail now. It might fail in 5 years, in 10 years. What's going to happen when when that happens? Is there a way to save my tooth? I'm seeing now online and with other dentists that I respect that they're looking at different ways and sharing different ways that they're saving teeth before they have to send anyone to an endodontist or things of that nature. And it's just really, I don't know, it's just really interesting and inspiring to see this functional and holistic movement happening in dentistry, because I've seen it for a long time in, traditional with ER doctors and internists and all these functional MDs that I work with now that spent 10 years in the ER. And they're like, I'm sick of Band-Aids. I'm sick of seeing the same people. Let's get to the root cause. This is not wellness, and they've made their way in a different direction. And it's just really powerful to see it happening in dentistry. So
yeah, there's such a shared core principle to all that, which is, nutrition.
right.
I mean, as you well know, I mean, it's like, if we give the body what it needs to be at its greatest state of health and do some degree of practicing mindfulness and keeping our body in a state of parasympathetic energetics, well, if we do those things and, then the body takes care of itself. Whereas if we're on the go, stressed out all the time, eating fast food and like, well, yeah, of course things are going to break down, whether it's your pancreas, whether it's your, bone health, whether it's your oral health, it's like, it's all the same thing. It's all, degrees of systemic breakdown. And some people express it more in one area of their body than another. So, but we don't treat dental issues as though it's connected to anything else. It's like you were saying for your ER friends, it's like, it's Band-Aid approaches, drill it and fill it,
So can we talk about, I mean, you said it, it's an organ in your body connected to living bone.
Yeah.
what's your approach when it comes to cavities, fillings, root canals? Like, how are you trying to help your patients?
Well, yeah, that's a good question. First of all, if somebody is experiencing, let's say it's dental decay,
Mm-hmm.
and frequently, sometimes people will say, I've experienced this all my life, you know,
Mm-hmm.
we have to get to the core issue of what's driving it. Not so the analogy I often use is, okay, you're coming in here and your teeth are melting. It's kind of like your house is on fire. The first thing that we would do if, God forbid either of our houses were on fire is call the fire department. We have to
Right.
put out the fire. We don't call up the contractor and start talking about where we want the new living room and the new roof, right? And that's what dentistry does. We're like, oh, you got a mouth fire. Let's just drill away the symptoms and fill it or cap it or,
Mm-hmm.
kill it, whatever the case might be. And as you can imagine, for a lot of people, it's driven by what they've been eating or how they've been eating. Frequently, that's an issue where, I mean, gosh, I see all sorts of iterations of this, but one of the more common, I'd say over the past 20 years is um, like bottled beverages. When I think back to my high school experience in the 1980s, you couldn't get a bottle of anything and if you did, it was a pop top, right? It's like you
Yeah.
couldn't reclose it. Nowadays, it's like whether it's, a Monster Energy drink or kombucha or their lemon and apple cider vinegar drink that they're thinking that they're drinking quickly, but it actually takes them 4 hours to get it all down. That chronic acidity,
Mm-hmm.
whether it's frank acids or it's sugars we're ingesting that then the microbes convert into acid, that stuff will melt your mouth. Uh, not to mention, I don't know what it's doing to your GI tract, but, and like I say, kombucha, not to pick on it, I like kombucha, but if you're sipping on something that's inherently acidic, even if you're thinking it's good for your gut, your teeth will pay the price, you
Mm-hmm.
know? So I've seen that a number of times where people are like, I don't really know. I mean, I think I only eat healthy foods but when we really dig, we'll
Mm-hmm.
oftentimes find like it might be the nature of how they're eating.
Mm-hmm.
If they're like a chronic snacker, let's say, like every hour I'm throwing something in my mouth. Well, you're rarely ever out of the acid pool then.
Yeah.
Your teeth are swimming in acidity. So once we figure out how or why things are not going well or breaking down, then the management is a lot easier over time. I'm fortunate now in my practice that we've created this awareness. So it's typically, not always, but typically people finding us who've already been on this journey. They've
Mm.
already figured out their gut health, and we're kind of the last stop on the Ferris wheel, so to speak. It's like, okay, I've done everything else. I've worked with Kelly, let's say, and now I need my oral health fixed up. So they call our office and they want to get their root canals out and deal with bone infection or whatever the case might be. Um, these days I have fewer conversations like that, but they do occur. And until we understand the system, we don't want to move forward with rebuilding the house.
Right. Well, it's important that you bring this up because I have such a large community of moms that follow along with young kids. And when you think about, I'm in the toddler stage. So I have a 4-year-old, a 2-year-old, and I'm due with my third in like June 1st.
Wow.
So we are in it to win it.
Congratulations.
Thanks.
Woo!
But when you think about toddlers, Sebastian, my oldest, is in preschool. I've been blown away, and it's a school where you can bring your own lunch and bring your own snack, but buy whether it's on his baseball team or whatever, the plethora of packaged crackery snacks and the sugar but it's the constant eating for toddlers. And for
Yep.
me, like we got to this place where when Bash was in school, I'm like, we are going to eat at Bash's school times. It is snack time. It is breakfast, lunch, snack, dinner. Like we cannot just have this pantry door open all day because if they given the option, they will snack the entire day. And that just sits in their teeth. And you brought up the most important point, which is even if that food is not acidic, if it's processed flours and sugars, your
Yeah.
microbes eat it up and give off acid. So you
Yep.
are just breaking down those teeth all day. So thank you for shedding light on the nutrition part, because
Yes.
so many kids have cavities nowadays. And
It's crazy. And how many places, if the fluoride concept were, held water, pardon the
yeah,
pun,
yeah,
it's like, well, what would we not have eradicated dental decay by now? And
yeah,
it's like, yeah, it doesn't work. It's like, so what? There's a little fluoride in the water, or you maybe use a fluoride rinse or whatever. One, it is toxic to your nerves, but let's say all the dental benefit that it can provide will be overcome by the chronic onslaught of acid.
right.
So it's, yeah, I've been blown away. I mean, thankfully, like my wife and I have two girls that are now like, they're adults, right? Young
Yeah.
adults. And when they were little, they didn't have access to all these little squeezy tube things that I see today.
Mhm.
Like moms are going around with their big purse or maybe their SUV that's literally filled with squeezy tube. Here's your quick shot of applesauce. You know what I mean? Like
Mhm.
like God forbid we should go 2 hours without eating, you know?
Right.
Yeah. So well intentioned, of course, but like if we know that puts the child in a state of greater risk for dental breakdown, because let me tell you, like, no parent wants to experience oral health breakdown and treatment for their children.
Mm-mm.
I mean, there are wonderful, wonderful dentists and pediatric dentists out there who are so loving and so kind and provide gentle care, but the best dentistry is absolutely no dentistry at all.
Right.
So if
Right.
if if the child doesn't have to experience going through dental restorations, it's just so much better for their long-term health.
Definitely. And it's giving us insight into their gut health and their overall system health, which it's just that's where you can see it. So let's talk about some of the things that are used in traditional dentistry and how you do them differently, because
Sure.
I am at that point where I am curious, should feeling the way I feel about this tooth even after a year, should I be I'm like happy that the bone is regrown, but I am still, my questions were, okay, great, but what happens in a year or 18 months? How do I know that there aren't microbes still in there that are gonna start multiplying and breaking that bone down again, or that I'm not dealing with, like I want the 100% answer that everything's okay. And
And
I
it's not.
also, yeah,
And
and
it's
when I
not, you know.
yeah, can you talk about, and I know that there are links between root canals and breast cancer. That's
Yep.
not something I want to have to go through. My mom went through that. I watched that.
Right.
Have friends going through it right now, and they're too young,
Yeah. Oh, yeah. Yep.
Talk to me about the science you're seeing in the
Yeah.
connection of root canals and whole body health.
Sure. Well, so where part of where it started for me was um oh, it was probably 6 years ago. I became aware of a company called DNA Connections out of Denver, and they they'll take anything you send them and analyze it for like hundreds of microbes. They have Lyme panels, they have oral panels, and out of just pure curiosity, I as I was extracting teeth, I would cut the roots off of the tooth. So the only part of the tooth that I was sending was whatever was in the bone, nothing
Mm-hmm.
above the bone.
Mm-hmm.
And I would send that because these were all root canal treated. And it's like, if what the endodontic profession tells us is true, that, oh, we've cleaned it out, right? Then there should be no microbes within that system.
Mm-hmm.
Well, the amount of stuff I saw in every tooth, I've sent over 500 roots now to this DNA Connections. I have yet to see one root come back that wasn't loaded with microbes from sometimes viruses like Epstein-Barr virus. Um, I mean, a multitude of bacteria, some fungi, Lyme micro. I mean, it's crazy, right? So 2 weeks ago, I did a post on my Toxic Tuesday that described the theory of how your lymphatic drainage system, which it's your lymphatics job to get rid of the garbage that's soaking in through your teeth all the time. So when you were describing your tooth and the situation that it went through over this past decade and a half, it's not like it suddenly became infected. It was
No.
always it's always loaded with microbes, whether you want to call that infected or not. I don't, that's whatever. But because you're healthy, generally speaking, and have an immune system that has the capacity to keep that at bay, it's been doing its job and getting rid of the garbage. It just sounds as though it got overloaded to the point where the immune system's like, oh man, I've got to take a different approach. And it decided to sacrifice some of the bone around that dead tooth and, have this buffer zone. And then when the endodontist went back in and restirred it all back up, it's resetting the system, but it's not a system of health. It's like,
Another Band-Aid.
It's still another Band-Aid, and it's going to require maybe a little less work on your immune system's part for a while until it gets crappy again. But it's two things, right? You have the microbial issue, which of course, like that's an issue in and of itself. There's also the bioenergetics of a dead tooth, a portion of energetic meridians, which formerly, when it was alive, could carry energetic flow normally. Once you kill that, it becomes more of a resistor. Yeah, blessings. So yeah, it's looking at the bioenergetics of root canals is something that is not really discussed. But if you read books by like Simon Yu, an internist in St. Louis, Missouri, and what he's talking about with his acupuncture meridian assessment, I mean, in both of his books, he talks over and over about what he has seen in his own practice, looking at people's, whole body health and seeing like, why are things so far off? And it's primarily, yes, it's primarily an issue of decreased energy flow.
All that to say,
yeah,
I think it's like suppressing my immune system too.
Well, I will tell you that if you talk to leading physicians who are savvy and aware of this stuff, they will tell you straight up, like, root canals have the capacity to greatly decrease your immune function. As part of that post I was mentioning, I started doing the deep dive into PubMed and looking into, help me understand, as it relates to lymphatic drainage and the valve systems that are within the lymph system, is that always like 100% sure and it always works? And come to find out, there are aspects of our lymphatic systems that when it's chronically being offended, which is the perfect case of both gum disease and root canals, because it just sits in there and it's subclinical. It's infected, but you don't have these acute symptoms that are raising their hand. Yet you might notice swollen lymph nodes or breast lumps or, some other organ system that's not functioning as well as it could. And we never look in the mouth because we've normalized killing teeth and tell people it's healthy, right? Mm-hmm. So it's, a root canal, it's funny because a root canal is a solution for a tooth that's already failed. It's a way of embalming it. And, it's kind of like, it's a gross analogy, but, grandma dies and you embalm her and prop her up at the dinner table and she's not alive or with us anymore, can't respond to stimuli, just like your tooth can't, and your body knows it, but we tell you, it's like, no, it's fine. It's like Weekend at Bernie's, I don't know if you ever saw that movie. I loved
that movie.
Yeah. I mean, that's the case with the tooth. It looks normal. And of course, we as restorative dentists can mask all the darkness that's happening underneath by putting porcelains on top, makes it look perfect. It's like our eyes are deceived, yet under the surface, things are grossly infected.
Yeah. Well, it does. It's all of these things kept coming up. You know, it's on the right side of my face, and I go to a holistic facialist when I can, and she uses lymphatic drainage wands, which are, you know, they're vibrating, and they do like, I think like magnetic resin, not magnetic resonance, but it's like something where it's like moving, it gets your lymph moving,
Yeah.
and it's awesome. It's the best feeling. And I feel like I leave and I'm like, someone just injected me full of Botox. My cheeks are 2 inches higher. But she did notice, she's like, you have swollen lymph nodes on this right jaw. And I can feel, and so she made me feel them. And it was something that I hadn't noticed. And I'm like, it's not a huge difference in size, but it's prominent enough now for me to be like, this is going to bother me. You know, like something
Right.
is, there's too many things pointing in that direction, and that connection between root canals and breast cancer, you know, it scares me. And so then I think, well, why wouldn't I just pull it out? Yes, I've
Right.
spent a year trying to make sure that it's good, but like, I want to know what's in there. I want you to send my roots to DNA connections. Like,
Yeah.
I want to see what I've been dealing with for this long. And if, you know, I wish it was the back tooth, the very, very last one, because then I'd
Yep.
just be like, forget it. I don't even want an implant. No one's
Yep.
going to see that. But
Yep.
to smile and to have a whole, can you talk about implants? Because aren't there times when implants, your body rejects an implant? There can be
Yeah.
disease around an implant. Like, what are the pros and cons to just saying, forget it, let's pull it out
Sure. Yeah.
and treat it that way?
Yeah. Which it's a great question because in reality, you can have a tooth taken out and not replace it. You know,
Yeah.
like people can live without teeth. I've had patients who had no teeth, you know,
Yeah.
like, or I helped them become without teeth because of their state of disease in their mouth and the rest of their body.
Yeah.
Um, so as far as it relates to options, you know, from a health standpoint, removing a dead tooth is the first step.
Yeah.
Now, in a situation like yours, where it sounds like it's your lower right first molar, it's a multi-rooted tooth.
Yeah.
Um, there are certain ways you could potentially get it taken out and put in the implant all in one day. On
I don't need
molar,
to do that.
yeah, from my perspective, it's like I want to be able to put that implant, if that's what we're going to do, directly in the center underneath the tooth so that it's optimally supported. That's how I approach it. But um, like I'm only in my practice now, I only use ceramic implants, and
Okay.
thankfully there are a number of great ceramic implants on the market. Surprisingly, it's not all that new. Like ceramic implants came on the European market over 20 years ago. They've been on the US market well more than a decade. Um, the technology has advanced so incredibly. One of the things that I do with great frequency, it seems like this is how I'm spending most of my time now, is taking out particularly single rooted front teeth, replacing it with an implant immediately because it adapts well for a single rooted tooth, and then putting on immediately a ceramic crown so that a person maintains their smile.
Mm-hmm.
They don't chew on it for a few months, you know, while the bone's adapting to it. And one of the things that I like to make clear for people is that, like, it's infrequent that bone rejects an implant. It has more to do with that the state of the health of the bone to begin with wasn't well.
Right.
So is it that maybe all the infection that was in that spongy bone didn't get cleaned out at the time the tooth was removed,
Yeah.
right? Or maybe your vitamin D level isn't at a state where, or you're not ingesting K2 so that your bone can actually, you know, heal itself appropriately. I mean, we offer a number of supportive therapies in our practice, whether it's ozone, vitamin C IVs, um, you know, using people's own healing cells. Like when I remove a tooth, every time I remove a tooth, unless it's like a religious exemption, which I'm going to respect people's beliefs.
Mm-hmm.
Otherwise, we will borrow blood, spin it out, take the healing cells from the blood, put it back in the extraction site. So you're using all your white blood cells and clotting factors to then expedite the healing process. But if you don't remove all the gunk in the bone first, all that LPRF will just fail, it'll
Right.
die off because it's not designed to do everything, right? So it's all about supporting the system and helping a person be ready for that kind of surgical intervention so they can heal, as best as possible.
Well, I took the approach of multiple treatments to ensure the bone was regrowing because I'd much rather have health than, I don't want to say vanity, but like for my teeth to look perfect. So I think for me, when I think about that, I'm like, well, if it's not that big of a deal, pull it out. How long would someone heal before you schedule an implant? When you
Sure.
pull it out, do you put the healing factors? Is it like platelets and white blood cells and all
Yeah.
that good stuff, clotting factor
Yeah.
at
It's
that
really,
time?
yeah. So basically, like right before the patient gets numb, we borrow some blood cells and in the tubes, put them in a centrifuge. Your red blood cells are heavy and they go to the end. The
Yeah.
plasma is very light and goes to the top. And then in between are all the white blood cells and your fibrin. It's like
Hmm.
a platelet rich fibrin membrane, which we then squeeze. We put it on a press plate, squeezes out all the rest of the plasma that you can. And then we use those membranes to put into the extraction site,
I love that. Using your own body's immune system, allowing for it to
right?
heal. So on average, how long does it take for for that, like, I want to say gaping hole, but
Yeah, yeah,
depending on the bone loss, like how long do you recommend people wait before they consider an implant in order to
sure.
have that put back in?
Yeah, on multi-rooted teeth like molars, typically it's going to be anywhere between maybe 6 to 8 weeks to 3 to 4 months. Depends on the nature of the situation.
Yeah.
So many of our patients travel from out of state. So you know, I don't want them to have to fly out in 6 weeks to find that you still have more to go. So sometimes we'll just wait for, 3 months, let's say.
Yeah.
But in a lot of cases, like you want to get back in there sooner than later because the walls of the bone are waiting to have a friend to hold on to. It's like
Yeah.
without a stimulation or a reason for it to be there, it will generally kind of shrink away over time.
Yeah.
But typically it's somewhere in that 2 to 3 month range. And then once we put an implant in, typically I'll wait about 4 months for the bone to attach to it.
Hmm.
It's possible you could go sooner, but if after 4 months we have an instrument that taps the implant and gives us tactile feedback about how firmly the bone is holding onto it. If
Uh,
it's doing well at 4 months, it's almost always going to go very well. Of course, sometimes things get weird, but with zirconia, a ceramic material, if the bone's holding on to it, it's typically going to last, and it's very interesting. I mean, I was putting in titanium implants for 15 years. The difference that I have observed in how human gum tissue adapts to that ceramic implant is night and day from titanium. So it's not to say that if you have titanium dental implants, like my wife has 2 titanium dental implants we did years ago, we're not just going to run in and take them out,
mhm.
provided she doesn't have like a systemic sensitivity to the materials that are in those titanium alloys.
Mhm.
But I will say, for those people who are sensitive to, let's say, like cheap earrings, typically it's women who might be aware of that. Yeah.
Mhm.
Usually that's due to a sensitivity to nickel. And every titanium implant has a small fragment of, or sometimes a fairly decent percentage of nickel in the alloy.
Mhm.
So imagine you put this into a person's body, a substance that they're like sensitive to, maybe allergic, however you want to look at that. The immune system's going to get woken up in a jiffy, right? And
Yeah.
I've had people come back and complain. This is before I had an awareness of this. They'd say like, "This is weird. You put in this implant, and I've had chronic tinnitus for the last 6 months." And I'm like, uh, let's start asking some more questions. Oh, you're allergic to or sensitive to nickel. That thing's got to
Yeah.
come out.
Yeah.
Yeah, and of course the beauty is with ceramic implants, you're not dealing with that type of potential sensitivity. because the entirety of the implant and everything on top of it, it's all ceramic. It's all pre-oxidized. There's nothing for your body to react with. So
that was going to be my question. If it's just the top ceramic and there's some type of alloy, or if the whole thing is ceramic.
Right.
What
No,
a great
it's
option.
all the way through. Yeah. No, it's totally cool. It's what's really unique about them too, for anybody who's had titanium implants. The titanium implant gets put in the bone and the implant itself stops right at the bone. So you have to have these parts that, extend through the gum tissue, and that's fine. I mean, it works. Whereas zirconia implants, the implant, the abutment part, all of that goes straight through the gums. It's all one piece. So there's no gapping point for microbes to get in. I mean, it sounds gross, but every once in a while I have to remove, the top parts from a titanium implant. And every single time you release that and open it up, it stinks. Oh, it's horrible. And the patient's like, "Oh, is that me?" And you're like, "Yeah, it's your implant. Sorry." No wonder your gums aren't happy, right?
It kind of reminds you of like a ill-fitting crown, or like something where it's just like, it's not going well.
Yeah.
So can you talk about the research? I know I've mentioned a couple times between root canals and breast cancer, if there was a study or what you've seen.
Well, I haven't seen anything that is definitively, because nobody's doing that study.
Yeah, right.
So if we say, well, there's no science, I think that, do we want to be dogmatic practitioners that, if there's no science, then it doesn't exist? Or do we want to use our knowledge and understanding of basic anatomy and physiology to see the patterns? And that's what what was a huge part of me getting into this approach to dentistry is, I mean, after, I don't know, 20 years of doing root canals myself, and then many of them, 5 years later, 10 years later, whatever, you're extracting the tooth. After I saw, I don't know how many hundreds of roots that were black inside, which I wouldn't be shocked if yours was when it comes out, because they always are, right? You pull them out and it's like, oh, how'd these microbes get in here? Oh, through the spongy walls that it's like open tunnels, right? They just march right in and then fill up that space. Nobody's done that study yet to look at, so as far as I know, like if you have root canals, because then you'd have to ask, well, what are all the other factors that go along with it? And how many root canals do you have? And which teeth are they? And that's what led me down the path of just simple lymphatic drainage to look at. We understand from the head, once we get down to the clavicle, that lymph should be dropping into the thoracic duct and going, circulating. But what if those, valves become dysregulated or deregulated by our genetic programming? And they can, which is shocking to me. And it's like, well, then the system just starts to back up. And that's a very easy way for it to get into those breast tissues. But similarly, once it's in the blood supply, then the blood goes everywhere. And where might one person have more risk than another? Well, that's bio-individual in nature. So, some people might be more at risk for that than others. I just, because root canal treated teeth present such a significant risk, both microbiologically and energetically, I believe it's appropriate for the human beings who have them or are considering them to understand that there are risks to your whole body health when you choose that. If they decide, you know what, I don't think that's what's going to kill me, and I want to have it done and keep my tooth, awesome. By all means, like, keep the tooth. I'm not here to say that root canals are bad inherently, but it's a medical procedure that has risks. So at the very least, I think informing people fully about that is appropriate. And my experience has been that does not happen by and large. I'm sure there are some who do offer that information, but by and large, it's not offered because they're just told you need it, Right. The common scenario, Kelly, is like people go in, they get dental work done, right? And maybe they're well-intentioned. I want to get my mercury out. Right. And then after the mercury is taken out and they do a composite filling, let's say, oh, my tooth hurts. Oh,
Right.
well, you must need a root canal. It's like, well, wait a minute now. It didn't hurt before we took out the mercury. What
Right.
happened? And
Yeah.
it's just like, it's kind of chasing your tail, and it's symptomatically driven, and it's not focusing on health. So there are ways to avoid these things, thankfully. And thank God there are so many dentists out there who really are becoming more and more conscientious. I mean, I was just having a phone call with a gentleman this morning. He practices down in Louisiana, and he saw me speak in New York, and he had great questions about biological approaches to care. And I just offer as much as I can, right? Because any one dentist I talk to has the potential to impact thousands of lives for the better.
Right.
So I'm always happy to share what I can.
Well, thank you for spending the time. I know personally how time consuming social media can be, and sharing and teaching or speaking. And it's outside of just your regular practice, but it makes a major impact. And I mean, we wouldn't be having this conversation if I hadn't talked to Peter. And I was like, this is crazy. And following along has been so much fun for me. I have a couple more questions before we end today's
You bet.
podcast. I obviously know mercury out. If I were to ask you like kind of like the hit questions, fluoride in or out?
Personally and professionally, I don't use it.
Yeah. I've opted out every time we've gone to our dentist with our boys, and we use hydroxyapatite. I don't know if you know Dr. Stacy. She's up in the Pacific Northwest too.
We are neighbors.
So
I was just with her 2 weekends ago.
great. She's been on the
Yep.
podcast too. Great tips for kids. I had her on the podcast when Sebastian was 2 and still had
Yeah.
his passy, and because of her, we pulled the wubba nubs, and it was amazing. His teeth weren't coming out at a point, and his jaw came back, and I'm
Oh yeah.
creeping in his room and listening for mouth breathing and all that stuff. But when they get older, wisdom teeth out or in?
Well, when you can keep your wisdom teeth, I think it makes a lot of sense to do so. However, if your teeth are coming in sideways, sometimes it's appropriate to take them out. So I guess the answer is it depends on the person and what their condition is,
When you've made it pretty clear, you're anti-snacker, and snacking also includes continually drinking beverages that change the acidity in your mouth.
Yeah.
When it comes to food, what are some of your favorite foods for oral health?
Oh boy. I love food, period.
Yeah.
But I will say, like in our house, I wouldn't say we necessarily follow any paradigm. I've worked with functional nutritionists to help me with my bio-individualized supplementing. Do I love grass-fed beef and chicken and seafood and all the great things we have access to in the Pacific Northwest? I love all of it. I personally don't eat gluten because of skin issues I developed as a teenager, which back in the early 80s was like, you got what? It's like, thankfully, the awareness of why that happens has come a long way. So we're kind of a gluten-free household. But yeah, I mean, we eat a ton of veggies, whole foods. Thankfully, both my girls also like to cook. So we just love good food.
That's awesome. And I would say we're probably aligned in that respect. When it comes to supplementation, is there anything you think people should be taking to maintain oral health? You mentioned vitamin D3, K2. We've got
Yeah.
a dropper at home for ourselves and the boys.
Yeah.
Anything else?
I would encourage people who have not read Dr. Stephen Lynn's book. It's called The Dental Diet. I don't know if you've talked with Stephen. He's a great guy.
He's also been on the podcast.
Oh, I love it. I just think that guy is so great. And that book is, all the fat soluble vitamins, which is why for people who practice vegan eating, there are ways you can supplement to, support yourself to get the fat soluble vitamins that you need, but it's a lot harder. So, and he goes through describing that brilliantly in his book. I mean, I've handed that book out to so many patients. Just, I mean, I keep a dozen copies around at any time because it's so helpful. Once they're doing the work at home, our job of doing this like patch up oral health stuff, I mean, I don't want to do that.
Yeah.
You know, I want to help people reverse the stuff that has been biologically distracting for them, the root canals, the titanium, the bone infections, because that's going to move the needle significantly in ways that they cannot once it's been done, right? But if people can figure out at home, like I can do all these things and my gut's going to be better, I'm going to poop on the regular, you know, which by the way helps, right? Detox is important. Yeah, I mean, it's once we're doing those things, then the body tends to keep itself in pretty good health.
I love it. It's awesome to hear a dentist talking about nutrition and lifestyle. Well, what can people, thank you for being here. I
Oh man, thank
appreciate your
you.
time. What can people expect from you when they follow online? And what do you want our audience to know your expertise is in?
Yeah, thank you for the opportunity to ask. So if I could ask your community, first of all, to follow me on Instagram, it's at Blodgett Dental Care, and share my handle with every human being that you know and love, because the sooner people understand what drives oral health and wellness, then we can take control of our diet. Like if there wasn't already a good enough reason, then, you know, maybe get Stephen Lynn's book, read that, become aware. My goal is to help the entire human race understand that dentistry is a positive experience. That's going to require a very significant effort in retraining oral healthcare practitioners to consider how they speak and listen to their patients. You know, you can tell I'm a little bit fastidious on how we say things. Like we don't use the word need in my practice. It's literally, we just don't use it. We also rarely, if ever, use the word should. So in order to broadcast a more thoughtful and intentional approach to people with their healthcare, in my arena, oral healthcare, I need people's help in broadcasting this message. I mean, it is tough. I'm literally trying to share truth and offer information that has a very high degree of energetic resonance. So I would love to help spread that across the world, so that people can have better experiences at the dentist. And what I do personally, as I had shared earlier, we're actually just getting to a point in my practice now where, because of a number of people wanting to come in and have their root canals taken out and replaced with ceramic implants, or whatever, however we're replacing them, if we're replacing them at all, we're no longer doing like cleanings and recare. So I'm using my dental teammates, dental assistants, hygienists, to do a lot of other supportive things, which help move people's health in a more positive direction. So that's what I spend most of my time doing, is like biological dental revision. So helping reverse the negative aspects of all the dental care they've had in the past, whether it's multiple metals, metal crowns, metal fillings, metal implants, you know, dead teeth, dead jawbone, you know, where people have had their wisdom teeth extracted and the bone did not regenerate appropriately. They're commonly referred to as cavitation lesions, and they can have a major negative impact on people's health. So it's a matter of supporting people in building up their immune system and their total energetic wellness prior to surgery, taking them through a positive experience in their surgical, which frequently is people, you know, like we work with anesthesiologists, so people can just sleep through it and then help them in their recuperation and regeneration phase, both in the office. Like we have a whole wellness wing that's dedicated to people having IVs and using our red light therapy, Novathorbed, and, you know, all these fun, awesome health promoting things. But also once they get home, you know, being well supported with their diet, you know, giving them, you know, things you can cook at home, which again, they'd be in Stephen Lynn's book. It's awesome.
So my question for you on those lesions is how are you how are you treating them? How are you taking care of them? Because if someone we know that you fix up the metals, we know that you replace implants and we
Yeah.
use 100% ceramic implants. I know that I can come, hopefully, fingers crossed, get on your schedule and get this thing out of my mouth.
Oh yeah.
And then and then if someone has had bone loss or bone infection, what would a traditional doctor tell them to do? And what are you doing differently?
Yeah. So that's a great question. The issue of, and I want to like clarify for the audience, the current term du jour is FDOJ, fatty degenerative osteonecrosis of the jaw, which just basically means you had a tooth out. In the body's response to try to heal that, let's say, some food particles got in there, or they used a lot of epinephrine with the anesthetic and the blood flow got reduced or something like this, right?
Mm-hmm.
And the body cannot build new healthy bone. It will frequently create this fatty area, like it almost looks like oil frequently, or sometimes it'll look black.
Mm-hmm.
Um, and just like a root canal treated tooth, now your body's immune system has to hold this thing at bay. And it costs you energy every day. And your lymphatics are working on draining the stuff off. Right. So occasionally, and I know some dentists who, well, let me clarify. First of all, it's not something we learned in dental school.
Okay.
Right. So this was something 6 years ago when I was first getting into biological approaches to care and learning about these things. I was like, whoa, like I had no idea. I have been, at Simon Yu's office in St. Louis and watched him use acupuncture meridian assessment to assess the energetic flow of those areas. And I've even sent my patients from Portland, to see him to have that done to validate what they're describing subjectively is corroborated by objective energy meridian assessment. But anyways, in those areas when it's just fatty, there's no like the energy flow is significantly decreased usually. So by and large, for a lot of those cases, I actually have to open it up, like
Yeah.
make an incision in the tissue. I have a specific ultrasonic instrument which helps me open up the bone space to get in there, and we're irrigating that with ozonated fluids, putting their LPRF healing cells back in there so that the bone can hopefully regenerate itself. Nothing's
Wow.
100%, but by and large, we see very significant health shifts once those are appropriately cleaned out. I would also share that for people who are suspicious that like, well, I felt like this, or I had dry sockets, or whatever the issue is, or they're 35 and having cardiac problems because they're the wisdom teeth are on the heart meridian. You're like, well, that doesn't make sense. Why would you have like tachycardia, spontaneous tachycardia at 35?
Yeah.
We can provide what's called neural therapy using an injectable procaine and ozone adjacent to these spaces, or in your case, we could actually do it adjacent to the root canal tooth to help prime the tissues there for extraction. But oftentimes people who are experiencing symptoms that they cannot understand, like
Mm-hmm.
the woman I saw this Monday was like, oh, I've had this headache and it's been killing me for months. We injected one spot where it looked like on her 3D cone beam x-ray, that CT scan, that it's like, well, I'm suspicious that something's not well healed there, but I can't say for sure.
Yeah.
And we did the neural therapy, and within 5 minutes, her headache was gone,
Wow.
and it stayed away for about 48 hours, which it typically will. And then it comes back.
Yeah.
And it's almost definitive that like, well, okay, there's probably something going on in there then. And we need to clean it out and allow your body to heal again. Yeah.
It's fascinating. There are so many different ways to just support your body's immune system to get back in alignment and be, from having your lymphs flowing the right way to not having dead organs in your mouth and getting rid of the alloys that your body's rejecting. Like that's the goal, right? We all want to be healthy all the way through, but we're dealing with a lot nowadays. So having the
Yeah.
support of what cool technologies like ozone and, giving me my white blood cells and all my platelets back, or whatever the case may be, like
Absolutely.
I'm in for it, because we don't want you just think about it as, and like you said, it's an energy suck where we need all of our energy just to stay well and be the
Yeah.
best version of ourselves. So
Yeah. Well, I think that the mouth is this, like detox these days. It's such a catchphrase, like, oh, I'm doing all these things to detox. And there's 8 mercury fillings in their mouth.
yeah,
It's like, it's hard to put out a fire when you're still pouring gasoline on it.
sure.
So it's, maybe some people are out there who just, they've never considered the extent to which their mercury in their mouths, for instance, are in fact every single day exposing them to toxins that their body would appreciate no longer being exposed to. As a matter of fact, my post this week was, I borrowed some video footage of the smoking tooth, where it shows like the vapors coming off of the mercury filling using a black light. And it's fascinating. I mean, this is just plain simple science that is grossly ignored in the dental field.
Right.
So we want people to be aware so they can make their own choices.
Well, thank you for sharing all of that information. No needs or shoulds, but just so much information where we can kind of trust our gut, our intuition. I kind of wish I didn't spend the last year trying to figure this out, but I've sort of had this underlying thing for a long time.
Yeah.
Obviously. And it does scare me that I'm pregnant right now with the situation. I
Yeah.
don't love that either. I'm like, oh, this is not the perfect timing for this, but I'm so thankful for your time, because there are so many people listening, I'm sure, have implants, mercury fillings, root canals. They're questioning what they should be doing with their kids or their families. So thank you, thank you, thank you for your time, for being here, for sharing your knowledge. For everyone listening, it's Toxic Tuesdays. You can look on your Instagram account and learn a little bit of something. Is there anything else people should be doing to follow along?
I'd say that's primarily it. They can look me up on YouTube. I've done, gosh, I've so much stuff on YouTube, from, speaking at nutritional conferences and speaking to other dental groups and sharing this sort of thing. And I've been on, gosh, maybe 40 or 50 podcasts sharing different iterations of what we're talking about. Yeah, I mean, I would encourage listeners to share it with their loved ones, because who knows which life might be saved by the information that we're discussing today. If someone has chronic oral infection or oral toxicity, it can take you down. So the sooner people can become aware and know their choices, the better.
Thank you. Thank you so much. And I will blast this out on social, share it on YouTube. You guys can find this video on YouTube. You can find us on Instagram. And thank you so much,
Thanks,
for your
Kelly.
time.
And I look forward to seeing you in Portland soon.
Yeah, I just decided, hopefully there's room on your calendar.
Oh, we'll figure it out.
Okay, thanks.